Phlebotomy Exam Review. Question 1. The antiseptic used for blood culture site preparation is option A, alcohol only, option B, iodine or chlorhexidine, option C, saline, option D, hydrogen peroxide. The correct answer is option B, iodine or chlorhexidine. Blood culture collection requires rigorous antiseptic preparation using povidone iodine or chlorhexidine gluconate to minimize contamination risk. Alcohol alone is insufficient for blood cultures due to its limited activity against skin flora in deeper layers. Question 2. What is a common use of fingerstick blood? Option A, CBC, option B, blood glucose, option C, blood culture, option D, coagulation studies. The correct answer is option B, blood glucose. Point-of-care blood glucose monitoring is the most common clinical use of fingerstick capillary blood. Blood cultures require sterile venous samples, coagulation studies need precise venous volumes, and while CBC can be done on capillary blood, it is not the most common fingerstick use. Question 3. Reflux of anticoagulant into a patient's vein may cause option A, hematoma, option B, infection, option C, tissue necrosis, option D, vision loss. The correct answer is option A, hematoma. Anticoagulant reflux can cause adverse reactions including hematoma formation and, in rare cases, systemic complications. To prevent reflux, the patient's arm should be kept in a downward position and tubes should be filled from the bottom up during collection. Question 4. Which tube is used for hematology testing? Option A, green, option B, lavender, option C, red, option D, gray. The correct answer is option B, lavender. Lavender top tubes containing EDTA are the standard for hematology testing, including CBC and differential, because EDTA preserves cellular morphology and prevents clotting without affecting cell integrity. Green, heparin, tubes are used for chemistry. Question 5. Which is the recommended antiseptic for blood alcohol testing? Option A, alcohol, option B, chlorhexidine, option C, iodine, option D, soap and water. The correct answer is option B, chlorhexidine. Isopropyl or ethyl alcohol must never be used to clean the site for blood alcohol testing, as it could contaminate the specimen and falsely elevate results. Benzalkonium chloride or chlorhexidine without alcohol are the appropriate antiseptics for this purpose. Question 6. An inpatient ID must include option A, name and physician only, option B, name and date of birth, option C, allergy status only, option D, billing information. The correct answer is option B, name and date of birth. At minimum, 2 patient identifiers are required for inpatient identification: full name and date of birth, or medical record number. These must be verified against the patient's ID band before any specimen collection to prevent patient misidentification errors. Question 7. The phlebotomist should collect a specimen for glucose analysis. Option A, after eating, option B, with no fasting, option C, according to physician order, option D, always in the evening. The correct answer is option C, according to physician order. Glucose specimen collection should always follow the physician's order, which may specify fasting, random, 2-hour postprandial, or time draws. No blanket rule applies. Collecting without following the order can lead to clinically misleading results. Question 8. Which of the following is the most appropriate site for a routine adult venipuncture? Option A, femoral vein, option B, cephalic vein, option C, radial artery, option D, basidic artery. The correct answer is option B, cephalic vein. The cephalic vein is a large, accessible superficial vein commonly used for routine adult venipuncture. The femoral vein is reserved for emergencies only due to serious complication risks, and the radial artery is an arterial structure not used for standard blood draws. Question 9. A light mix sample appears? Option A, clear, option B, milky, option C, dark red, option D, yellow. The correct answer is option B, milky. Light meal produces a turbid, milky white or cream appearance in plasma or serum due to elevated triglycerides and chylomicrons, typically from a non-fasting state. Yellow appearance indicates icterus, while dark red or pink indicates hemolysis. Question 10. A patient with known fainting history should be: Option A, placed in supine position. Option B, allowed to stand. Option C, told to flex arm. Option D, asked to walk around. The correct answer is option A, placed in supine position. Patients with a history of syncope should be placed supine, lying flat, before venipuncture to prevent falls and injury if vasovagal response occurs. This is a proactive safety measure that does not require waiting for symptoms to appear. Question 11. A patient with latex allergy should be drawn using: Option A, latex gloves. Option B, non-latex gloves and supplies. Option C, standard tourniquet. Option D, no gloves. The correct answer is option B, non-latex gloves and supplies. Patients with documented latex allergy require a latex-safe environment, including non-latex gloves, nitrile or vinyl, latex-free tourniquets, and latex-free bandages to prevent potentially life-threatening anaphylactic reactions. Question 12. How should a heel stick be performed on an infant? Option A, medial or lateral plantar surface. Option B, center of heel. Option C, arch of foot. Option D, toes only. The correct answer is option A, medial or lateral plantar surface. CLSI guidelines specify that infant heel sticks should be performed on the medial or lateral plantar surface of the heel to avoid the posterior curvature and calcaneus bone, puncturing the center or arch risks bone injury, osteomyelitis, and nerve damage. Question 13. Which is the most common site for routine adult venipuncture? Option A, median cubital vein. Option B, radial artery. Option C, dorsal hand vein. Option D, femoral vein. The correct answer is option A, median cubital vein. The median cubital vein in the antecubital fossa is the preferred site for routine adult venipuncture due to its large size, superficial location, and minimal proximity to major nerves and arteries. The radial is an artery, femoral is an emergency-only site. Question 14. If the tube is underfilled, test results may be: Option A, accurate. Option B, altered due to additive ratio imbalance. Option C, unaffected. Option D, faster to process. The correct answer is option B, altered due to additive ratio imbalance. Underfilling alters the ratio of blood to additive, particularly critical in citrate tubes where excess citrate causes falsely prolonged patient/PTT. Proper fill volumes are calibrated by the manufacturer and must be achieved for valid results. Question 15. Phlebotomy safety includes avoiding: Option A, hand washing. Option B, recapping needles. Option C, using sharps containers. Option D, proper PPE. The correct answer is option B, recapping needles. Recapping used needles with two hands is prohibited under OSHA's blood-borne pathogen standard because it is the leading cause of needle stick injuries. Safety-engineered devices or one-handed scoop techniques must be used if recapping is absolutely necessary. Question 16. Phlebotomy should not be performed on: Option A, arm with fore. Option B, non-dominant arm. Option C, forearm vein. Option D, hand vein. The correct answer is option A, arm with fore. Venipuncture should be avoided on an arm with an active fore line because fore fluids dilute the sample and compromise test accuracy. The non-dominant arm, forearm veins, and hand veins are all acceptable collection sites under appropriate circumstances. Question 17. Which is true about using evacuated tubes? Option A, remove cap before insertion. Option B, push tube into holder. Option C, tube fills automatically by vacuum. Option D, requires syringe. The correct answer is option C, tube fills automatically by vacuum. Evacuated tubes fill automatically when inserted into the holder and the needle enters the vein. The preset vacuum draws blood into the tube without manual aspiration. Caps must not be removed before insertion as this destroys the vacuum and prevents filling. Question 18. The first step after identifying the patient is to: Option A, apply tourniquet. Option B, wash hands. Option C, prepare equipment. Option D, ask for allergy history. The correct answer is option B, wash hands. After patient identification, hand hygiene must be performed before any patient contact or equipment preparation. This sequence prevents pathogen transmission and complies with infection control standards. Skipping hand hygiene is a significant safety violation. Question 19. A blood smear is primarily used in option A, coagulation tests. Option B, CBC differential. Option C, chemistry profiles. Option D, urinalysis. The correct answer is option B, CBC differential. Blood smears are examined microscopically as part of the CBC differential to assess RBC morphology, WBC types and morphology, and platelet estimates. They are essential for diagnosing conditions like malaria, leukemia, and sickle cell disease. Question 20. Which tube is most suitable for stat chemistry tests? Option A, gray. Option B, green heparin. Option C, light blue. Option D, lavender. The correct answer is option B, green heparin. Green top heparin tubes are preferred for stat chemistry because plasma can be separated immediately after centrifugation without requiring a clotting period. SST/red top tubes require 30 minutes for clot formation before processing, which delays stat results.